Good morning, everyone. This is Karina Hill with the Florida Alcohol and Drug Abuse Association, and I would like to welcome everyone to today's webinar entitled Patterns and Trends of Substance Use Within and Across the Regions of Florida, to our annual report with Dr. Kelly Gurka. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. A couple of quick notes. You're in a listen-only mode, so you're only going to be able to communicate through our Q&A panel or our chat panel. Whenever you need to address myself or the presenter, please put your questions in the chat or Q&A panel, and make sure that you select host and presenter whenever you're responding to Dr. Gurka's questions, or if you have questions to her. You should have computer audio through your internet, and if not, if you're experiencing poor computer audio, you can always call in to our line, our WebEx phone number and access code there. You want to check your I will call in option to be connected, but wanted to make a quick note that you do need to also be able to view the presentation. So if you do connect through the phone, please make sure you view through the computer to get credit for your CEUs. The recording of today's presentation will be on our site within 30 business days. You can find it in our resource center and our training library. Also, the materials will be posted as well. One helpful hint is you will receive an archived video display that looks like an error message. You just want to ignore it, hit play, and just enjoy. So check out the recording and the presentation materials in our resource center training library. At the conclusion of today's training, you're going to get a message through your web browser that directs you to the evaluation. You will also receive a follow-up email to the link that's a thank you letter for attending today. Just one quick note, you need to make sure that you have a FADA account set up prior to completing the evaluation. We do offer 2 CEU credits, or up to 2 CEU credits for today's webinar. FADA produces many webinars and workshops to the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we also host an online community that provides a digital journal where you can maintain your statements of credit for your webinars and workshops that are taken through FADA. At the end of the webinar, remember you will need to take the evaluation. Your information that you provide FADA as part of registering remains confidential. Your statement of credit will be posted within 30 business days after the evaluation closes. And again, it's necessary to complete the evaluation to get CE credits or to access your statement of credit. The evaluation will close on Friday, June the 19th at midnight. Again, you'll get up to 2 continuing education credits for participating in today's webinars for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, you will need to include your Florida license number so that we can report it to CE Broker when you register to our site. If you are certified with the Florida Certification Board outside of the state of Florida, you do not need to provide your certification number when you register with our site. One thing you want to note is also that WebEx does monitor your arrival and departure. We cannot provide CEs or a statement of credit if you do not attend the entire webinar. So we do not give partial credit. With that being said, I'd like to go ahead and introduce our presenter today, Dr. Kelly Gurka. She is the Assistant Professor of Epidemiology at the University of Florida. She earned her MPH at the University of Alabama at Birmingham, after which she served as a maternal and child health epidemiologist in the Alabama Department of Public Health. Dr. Gurka then earned her PhD in epidemiology with an emphasis in injury prevention and control at the University of North Carolina at Chapel Hill. Dr. Gurka previously held faculty positions at the University of Virginia and West Virginia University. Dr. Gurka currently serves on the Science and Research Committee for the Society of Advancement of Violence and Injury Research and is a member of the American Public Health Association, as well as the Society for Epidemiologic Research. She is also a member of the University of Florida Center for Addiction Research and Education, with funding from agencies through NIH, CDC, and HRSA. Dr. Gurka has conducted and published research on a range of topics, including maternal and child health, workplace violence, sports injury, and substance abuse. And now, Dr. Gurka, if you're ready, I'll go ahead and turn things over to you.
Thank you, Karina. Can everyone hear me?
Yes, we can.
Yeah, we can hear you.
Karina, I don't seem to be able to advance the slides.
Okay, let me try it one more time.
Okay, there we go.
Okay.
About that technical glitch for a moment.
That's
Good morning, everyone. Thank you for that nice introduction, Karina. Again, my name is Kelly Gurka, and I'll be going through patterns of and trends in substance use within and across the regions of Florida with you this morning. In addition to FADA and the Florida Department of Children and Families, oh, I can't seem to, oh, there we go. I'd also like to acknowledge Greg DeCanio, who is a recent graduate this past spring of the University of Florida, who helped me put together this presentation. So we'll start off with a bit of an introduction. So these are the learning objectives for today's webinar. By the end of this webinar, you should be able to describe recent patterns of substance use in Florida overall and by region, and we'll talk about those regions in just a few minutes. Identify important trends in substance use in Florida over time, and compare patterns and trends of substance use in Florida with those of the U.S. overall. So as the behavioral health workforce, you are tasked with promoting the health and well-being of Floridians through the prevention and treatment of mental health disorders, including those related to substances. To effectively target resources to prevent or delay initiation of substance use and treat existing substance use disorders, behavioral health workforce at the state, regional, and local levels must be aware of the current patterns and trends in substance use across the state. Thus, the purpose of this webinar is to present the current distribution of substance use and select consequences based on publicly available data that we've gathered and collated for you. So I'm first going to talk about the methodology that we use to put together the data that we'll be presenting to you today. So this is an injury pyramid, and we often use this in the injury world to depict the burden of disease. And so we can apply this to substance use. And you'll notice that we often talk about the tip of the iceberg being deaths. So deaths are fairly easy to count, right? We have a national vital statistics system in place that accounts for every single death, theoretically, that occurs in the nation. And along with that, we are given information or collect information about the cause of death. If you work your way down the pyramid, you'll see that the severity of the consequence associated in this particular case, substance use, decreases as the incidence increases. So there are more hospitalizations for overdoses, for example, than there may be deaths from overdoses, and then emergency department visits, other negative consequences, and then at-risk behaviors. So the way we've arranged this presentation is starting at the bottom and looking at the prevalence of drug use to begin with, and we work our way through the presentation moving up the pyramid to the most severe consequence of death. And just to give you an example of what this looks like for one specific substance, this is a pyramid that was created by the CDC, their National Injury Prevention and Control, Center for National Injury Prevention and Control. And this depicts for every one prescription or illicit opioid overdose deaths that occurred in 2015, there were 2,946 people who had used prescription opioids in the past year. And so that just gives you an idea about, for every one death, you have all these other layers of various levels of severity of use underneath that. So another thing that we should talk about is the managing entities. So many of you on the webinar are probably very familiar with the managing entities, whereas others may not be, depending on where you're doing your work. So the Florida Department of Children and Families contracts with 7 nonprofit behavioral health managing entities throughout the state. And I'll refer to those as MEs through most of the presentation. Through their network of local mental health and substance abuse providers, they provide community-based services to their respective regions. So throughout the webinar, we present the prevalence of substance use, for example, by both the state overall and compare it to the US. And we also present it by managing entity region. So this is a map of the managing entities, or the regions that they serve. So here's the state of Florida with the Department of Children and Families regions, and you'll notice it says Northwest, Northeast, Central, Suncoast, Southeast, etc. In this tiny little writing that I'm hoping most of you can read, there is a list of the circuits. So there are also 20 circuits in the state that align with the judicial circuits. And also depicted on this graph then is the managing entities. So I'll be referring to these areas, the various MERs throughout this presentation. You might all want to take a moment to note, for example, if you're working in Lee County, that you are part of the Central Florida Behavioral Health Network region, and notice the color. I will not be putting this map up again during the webinar, but I do use this color scheme throughout the presentation. So if you want to track your region-specific prevalence, for example, you'll want to note what color that is. Okay. And then here's a list of Big Bend Community-Based Care, which I abbreviate BBCBC. It's comprised of 18 counties, largely in the panhandle of the state. LSF is in the north central and northeastern portion of the state, comprised of 23 counties. Central Florida Behavioral Health Network is comprised of 14 counties that are in the Suncoast and some of the south central part of Florida. And then the Central Florida Behavioral Health Network Central Florida Cares Health System is comprised of 4 counties, and that's in that east central part of the eastern part of the central region of Florida. Southeast Florida Behavioral Network is going to be abbreviated SEFBHN, and again, that's those couple of counties that comprise most of the southeast region. Broward has its own ME, the Broward Behavioral Health Coalition serves Broward County, and then the southern 2 counties of Florida, Monroe and Dade, are served by the South Florida Behavioral Health Network. So this is a slide that shows all of the data sources that we will be presenting today. I just wanted to give you a little bit of information about, and I'll go over each of these specific data sources as I introduce the findings, because this is a lot to digest in one slide. But all of these data that we compiled are publicly available. Sometimes we can get the data source itself and analyze that data, for example, calculate rates for these various regions. Other times we go to public-facing dashboards and get these data as well, and that'll be noted on the slides as we move through the presentation. So now let's get into some of the data. So the first data I want to show you is population data. And so the source for this is the Bureau of Economic and Business Research, and we have these data compiled from 2000 through 2019. Just to give you a sense of the population of the state in the latest year, in 2019, there were over 21 million people living within the state of Florida. And about 80% of those are adults. So the other way in which we will present these data is not only for the US, Florida, and by region, but we also present the data for adults age 18 and older, and then for youth age 12 to 17 years. So in Florida, adults that are 18 years of age and older comprise about 80% of the population, and then youth age 12 to 17 comprise almost 7% of the population. We've shown here the population by the region, the size of the population that each managing entity serves. And you'll notice that the population is not evenly distributed amongst these regions. So the largest region is the Central Florida Behavioral Health Network that we talked about, serving kind of the Suncoast area and then a little bit of the South Central region of Florida. Followed by LSF Lutheran Services Florida that serves North Central and the Northeast portion of the state. So this is just to give you a sense of who's serving what proportion of the community in Florida. So now we'll talk first about, again, thinking about the bottom of the pyramid and at-risk behaviors. And so in order, the first stage in, moving on to some of these more adverse health outcomes related to substance use, we're going to look at the prevalence of just substance use to begin with. So for the adult data, all of the prevalence information that we will be presenting is from the National Survey of Drug Use and Health. So it provides national and state level data on the use of tobacco, alcohol, and drugs and mental health in the U.S. annually. The data that we will be presenting for adults for the U.S. and Florida are 2-year averages. When we start getting down into the managing entity region specific data, those are 3-year averages. So you will notice some differences between timeframes, for example, that I'll try to point out as we go through the data. For youth data, we have some additional sources of information. So we have Monitoring the Future, which is a national survey sponsored by the National Institute on Drug Abuse that will also be reporting, as well as the Florida Youth Substance Abuse Survey. So you'll notice as we go through these slides that for the youth in particular, we have lifetime use, past year use, and past month use. So you'll want to be mindful of paying attention to the different time frames. In addition, the Monitoring the Future data are reported annually for the U.S., whereas the Florida Youth Substance Abuse Survey, they report those data are collected every other year. So you'll notice that in the graphs that we don't always have a data point for every single year. So that explains some of the differences that you'll see as we present the data. So generally, if you look at the whole time frame for which we report data, substance use among adult Floridians has been stable over time, with the one most notable exception being marijuana use, and it's been increasing slowly since about 2006. Among adult Floridians, the prevalence of use of the substances that we report here is similar to the prevalence for the nation as a whole. And we see very few differences by managing entity region. When there are differences to report, I'll show those to you. And I want to note that these are the general trends over the time period. As we go through the data, I'll point out some changes that we've seen in recent years in terms of the current patterns of substance use. Among youth, generally the prevalence of current substance use among youth in Florida has been stable over time. The good news, however, is that lifetime use is declining over time for most substances for which we do reporting here, with a few notable exceptions. And again, I'll make note of those as we go through the data. Among Florida youth, the prevalence of use of the substances reported is generally similar to or less than the prevalence for the nation as a whole. And with few exceptions, again, there is not a lot of variation between the managing entity regions. One of the things that I want to point out is, dependent upon the data source, you will see some differences in the prevalence for each specific substance. Again, note that I said that these are reported for lifetime, past year, past month. So you will see, if you're looking at NISDA data versus Monitoring the Future data, there'll be some distinct differences. Those differences in the prevalence by data source are fairly consistent throughout the data. and you'll see that as we go through the graphs. So now we're going to go through a long series of graphs. So you might want to make a few notes, and again, the slides and all this will be available to you. So here's past year pain reliever misuse among adults, and I want to make a note about the definition of past year pain reliever misuse. Previously, NSDA, you'll notice there's a break in the graph here. NSDA asked about non-medical use of pain relievers in the past. There was a fairly significant change to the survey in 2015, and now the question is about pain reliever misuse. So I just want you to be aware that the data on this graph are from really two different questions. And you'll notice that Florida tracked well below the U.S. In the middle section of this time period. But we have seen an uptick, it looks like. It's hard to tell because we have some missing data, again, in the middle there where there's that change in the survey methodology, where now the rate in Florida is a bit above the U.S. If we look at past year non-medical use by managing entity region, you will notice that there is a fair amount of difference, with the Panhandle having the highest prevalence rates and really South Florida having the lowest rates, with both Broward County and South Florida at the bottom of the chart here. I do want to make a note about both opioids and tobacco. So because in the state of Florida we have reports specific to those types of substances, I don't go over tobacco during this webinar, and I will spend less time on opioids because there is a report specific to those substances. But given the impact that opioids has on health consequences related to substance use, I do go over them a little bit here in the beginning, and a little bit for hospitalizations and mortality as well. So if we look at past year heroin use among adults, you'll notice that this is one other thing to point out here is if you look at the y-axis on this graph, this prevalence goes up to 10%. With the heroin, we only go up to 5%, so this is a much lower prevalence with heroin, which would be expected, compared to non-medical use of prescription opioids. And these numbers, you'll notice, have been fairly stable over time. If we look at past heroin use for this brief period of 2014 to 2016, these 3-year average, and we look at them by managing entity region, we see a similar pattern in that the Panhandle has these higher rates, although we didn't see this as much with the Southeast region here. And again, Florida is in black over here, so you can see how there isn't a lot of difference between each region and the Florida average. So now if we turn to youth, this is past year pain reliever misuse. We see a much different trend among youth than we did among adults, and a steady decline over time. Now, you'll notice that Florida diverged from the national rate a bit, and as we've gotten over here to where we have the new question, Florida has bumped up again over the national rate. So still seeing a decline, maybe slowing down in the last couple of years. So that'll be something to track in the future with additional years of data. If we look at the variability by easy for me to say, managing entity region, again, you'll see there is a fair amount of variability here, again, with prevalence tending to decrease as you move south through the state. So Panhandle up here in the BBCBC region is the highest, LSF kind of moving east and down to the southern part of the, or central part of the state. And then you'll notice that again, South Florida and Broward County, although Broward has had a little bit of an increase here, and South Florida a little bit as well, whereas everyone else was trending downward. And you'll notice that when we do some of this managing entity specific data, that we don't have the data for as far out as we do for the state as a whole, again, because of the sub-state estimates, we don't have as much data for. And I'll point out some important differences that we'll see as we go through these data. Past year heroin use among youth, we did see a slight increase in recent years, but for the past 2 reporting periods, it's been a bit of a steady decline back to converging with the national rate. If we look at heroin use among youth lifetime and past months, you'll notice that overall it looks like there is a declining, for the whole time period, there's a bit of a decline. But you'll notice if you look at Florida in the last 2 years, we've had a slight increase from 2018 to 2019. And those rates have been bobbing up and down a little bit for the last 5 years or so. So whereas Florida was below the national average, we've kind of converged with that again. So, and you can't see with the past month use, the blue and the gray have come together. So that's why you can't see that blue line for these most recent years. But even in past month use, we've seen a little bit of an increase in the last year for which we have data. So if we move past opioids and onto psychostimulants, we'll start off with cocaine. So for cocaine, you can see if you look at use among adults, this is past year use. If you look for the whole time period, it's been fairly steady over time, a little bit of a decline in the middle of the time period and maybe a bit of an increase in more recent years. Florida and US, the rates have been going back and forth in terms of who has a higher level of use and lower. But you will notice for the past 2 years, for which we have data in Florida, we've seen an increase in cocaine use among adults. If we look at this use by managing entity region, we see that there is some difference. And I'll show these data by managing entity region for you here. So here is the Panhandle, and their rates are consistently above the Florida rate overall. Although encouraging here that we have seen a leveling off. Again, this is a point where I'd like to note that these data, this is the average between 2017 and 2018 here when you're looking at the statewide data. And here, these data, we only go through the 3-year average here. So just keep that in mind when we're looking at the managing entity-specific data. So a little bit of a leveling off there. And again, we see this is Central Florida, so the East Central, those few counties on the East Coast, closer to the state average. And then as you make your way from LSF, which is the Northeast and North Central Florida, pretty consistent with the state overall. Same thing with the Central Florida Behavioral Health Network, which is Suncoast and that south central portion of the state. And then as we move further into the southern part of the state, you'll see a little bit of a bump here, an increase, a pretty big increase there, relatively speaking, because these are low percentages. But a fairly, now where the rate in the Southeast Florida region is above the state average. And here we have Broward, and then again, South Florida below the state rate. If we look among youth, you'll notice that the trend over time is a little different. It's going more consistently it's declining more consistently over time. And the rate in both, the prevalence in both Florida and US is much more consistent with one another. If we look at past year cocaine use among youth, you'll notice that there is not as much difference, particularly in more recent years by managing entity region. But if you look at cocaine use lifetime in past months, you'll see that a similar trend to this, although it's a little flatter here for the current use. So Florida, for lifetime use, our youth are reporting a much lower prevalence than for the nation, and then a little bit lower here for current use. I'll make a note too about the past year cocaine use, which is, you'll notice the source of this was NSDA, and for the lifetime and current use, it's from Monitoring the Future and the Youth Substance Abuse Survey. These surveys are also conducted in different ways. So NSDA is a household survey that's done at home. It is given to participants on a laptop so that it's theoretically private, whereas the Monitoring the Future and the Youth Substance Abuse Surveys are done, the Florida Youth Substance Abuse Survey, are done in a school setting. So that may in part account for some of the differences that you see in these, but these are also different time frames. So you can interpret these data kind of as a whole. And you'll notice that if you look at the trend over time for these data, it is pretty consistent for the different time frames. No, it's just, I do see, I may not be very consistent about noticing questions in the chat, but if I'll take some quick questions like this, that no, this is just cocaine overall. And then we'll have time for questions. I didn't mention this. We'll take a break about halfway through and we'll have some questions. We can take a couple of questions then and then again at the end of the session, the webinar. So here's lifetime cocaine use among youth by managing entity region, and you'll notice there is more variation between the MER. And here we have Southeast Florida, which is, you see this increase in in the region compared to the state here. We also have up in the Panhandle a higher rate, although they've seen a decline in the last couple of years. Central Florida and then LSF is pretty consistent with the state overall. And then again, moving down to where you're seeing rates lower than the national, the state average. And then here's Broward again. And then this is past month, cocaine use among youth. And again, there's maybe a little less variation here than before. So you can see a little bit of a convergence in the middle here, and maybe we have some regions having a bit of more variation here. All right, so now we'll move on to methamphetamine. So we have less data for this drug specifically. You'll look at, this is again amongst adults, so US and Florida. Fairly flat in Florida, although we've seen a little bit of an increase in the US as a whole. If you look at youth, very similar pattern between Florida and the US. If we look at methamphetamine use among youth lifetime and past months, again, you see some decline, greater decline in the nation overall than you do in the state of Florida, but Florida still remains large, or at least slightly below the nation as a whole here in recent years. And then a little bit flatter in terms of methamphetamine use, current use. And you'll notice that in 2015, Florida, well, it's been about, I guess, since 2012, that Florida use among youth is higher in Florida than it was for the nation as a whole. Fairly flat the last year. And some of these use patterns I'll put into perspective for you when we get to the end of the webinar in terms of thinking about other consequences such as overdoses, fatal overdoses in particular. So if we look at lifetime methamphetamine use among youth by region, there's a fair amount of variability here, and you can see that in some of the regions that have lower use, they are seeing increases at the end of the period of observation. Here's the past month, maybe a little less variability, and we'll show these on graphs for you by region. So this is, again, the Panhandle, and pretty consistent with the state rates overall. A fairly large decline early in the period, and then a more gradual decline over time. And then current use, defined by past month, it's been a little bit flatter. And when you see these kinds of declines, that indicates potentially delay in initiation, for example, because you have birth cohorts that are being asked this question. And the Monitoring the Future survey is administered to 8th, 10th, and 12th graders, and the Florida Youth Substance Abuse Survey is also administered to middle school and high school students. So if you look for LSF, a similar pattern, very close to the state in the region and the state, and a similar pattern to what we saw in the Panhandle. Here is the Central Florida Behavioral Health Network. So this is the Sun Coast and that south part of the central region of Florida. And again, very similar to the state of Florida in the middle of the time region, but a little bit of an increase in the most recent years. over the prevalence in Florida as well. The trend is kind of flattened out there. We have this is the East Central, and so tracking a little bit below the state, seeing that same general pattern of a decline over time in lifetime use, but a much more flat pattern trend over time for past month or current use. And then again, not a lot of variability with Southeast from the state rate. And then here are a couple of those that you'll note when I showed you these data for the MER all-in-one graph that we saw some rates were lower in Broward and South Florida, but then you see an increase here in the last from 2016 to 2018. So in spite of these rates being lower than the prevalence overall for the state, we are seeing a bit of an increase here that may be a cause of concern. And then we see that same pattern here in South Florida where there's been an increase in the past 2 years. So if we move on to marijuana, you'll remember from the first introduction slide talking about use that one of the trends that we do see in Florida is an increase among adults over time. And you'll see on this graph, now you'll notice the y-axis here, we're getting into higher levels of prevalence here with this particular substance, that over time this is increasing slowly. And that's been true both for past year and past months, tracking very closely between Florida and the nation, although there's been a slight bit of divergence from the U.S. in this latter half of the period. If we look at past year marijuana use among adults by MER, there is a little bit of variability here. And here is, so that was past year and then past month. So these are graphed together, past year being the solid line and past month being the dotted line for each of the regions. So again, we see up in the Panhandle higher prevalence rates for marijuana compared to the state. This is moving across, east across the state and down to the central part of the state. Higher than Florida, but not quite as much difference as we saw in the Panhandle. And as we move into the central part of the state, we look at a little bit higher rates, but pretty close to the Florida. Again, similar to what we saw in northwest and central, north central. And then as we move a little bit further south, so this is that the Sun Coast, it's about the same as the rate overall for the state. And then we start to see rates dipping down as we get into Southeast Florida, Broward, and South Florida, Monroe, and Dade. I'm going to go back one slide, and you'll notice that we had a little bit of a shift here in terms of these rates in Broward jumping a little bit higher than the state overall. So that same pattern that we've seen with the prevalence seeming to decrease as we move south through the state. That won't be true for all of the substances as we get through some of the others in just a minute. So now if we switch our attention to youth, you'll notice that you do not see that same increase over time among youth that was observed among adults. Again, the rates in Florida are tracking very closely to the rates for the nation, and we have both past year and past month use here being fairly steady over time. So if we look at marijuana use among youth by managing entity region, you'll notice there is some variability by region. Less so for most recent use. You can see these lines are a bit more tightly packed. But we'll look at those by each region. So again, marijuana use. So here's lifetime and past month. So here's lifetime and past month for the U.S. and Florida. Here you can see that for Florida, if you look over time, we've actually seen a fairly, it's a modest decline, but it's a fairly steady decline in the last 5 or 6 years. And you'll notice the divergence here between the prevalence in the nation versus the state of Florida. The gap is widening a little bit. And we see that also with current use. So Florida consistently tracking below the nation, and a little bit steeper decline as we see these prevalence rates diverging from one another. So if we look at that by managing entity region, we see a fair amount of variability here, particularly more early in the period, less late in the period, but you will see that there's at least a couple of regions that have cause for concern in the most recent years. Their trend is not similar to that of the rest of the state. So if you look at lifetime marijuana use among youth in the Panhandle, that use seems to have declined at a faster rate than for the state as a whole. So early in the period, the rates were higher than the state overall, but lower now in more recent years. If you look at Northwest, North Central Florida, the trend is very similar in that region of the state compared to the state as a whole, tracking a little bit above the state prevalence, but the trend is consistent over time. Again, if you're looking at the Sun Coast and South Central Florida, similar, very consistent trend over time between the region and the state as a whole, with a decline in recent years. A little bit of a switch between this right in this middle section, but again, the trend is about the same. Whereas if you get down to the southeastern part of the state, you'll notice that the trend was pretty consistent with the state over time, big decrease over 2 years, but then this is one of the few regions where we've seen an increase in recent years, such that they went from below the state rate to above the state rate. And again, this is one of the few regions where we've seen an increase in marijuana use among youth. Central Florida, this is again that East Central Florida, rates have improved and gone down, and same thing for Broward County. And then this is the other region where we have seen an uptick in the last 2 years, is in the South Florida, which is Monroe and Dade counties. So consistently below the state average, or the state rate, but a little bit of an increase in the last couple of years. And less consistency with this trend over time as well. So here we'll look at past months marijuana use among youth. I'm seeing a question in the chat, is there a difference between the legality of marijuana where use is concerned? So for this is just any use. It's not asked about whether it's medical or otherwise. Lifetime synthetic marijuana use among youth. So this, we have by managing entity region, and you'll notice that the trend, there's more variation between the managing entity regions early in the period, and these rates are getting closer, and they're not very different here in this more recent period. And you'll notice that over time in Florida, the trend is to, that use is decreasing.
Dr. Gurka?
Yes?
I think someone wanted to look at a previous slide. The question says, with the y-axis, is this total usage or per capita?
Oh, so which slide?
I'm actually not sure what they're referring to. They just said, is this total usage or per capita for the y-axis?
So this is prevalent. So this is the number of people that report use over the total population. So
okay. They're saying all slides. Sorry.
That's okay. So it does change. So these are prevalent. So and technically it's of the people that participated in the survey, what proportion reported use compared to everyone that was asked. But because the way these surveys are done, we can, it's believed to be representative of the state and the nation. All right. So the previous slide was lifetime. This slide is past month, and you'll notice there's a lot less variability among the managing entity regions here, and that we see a fairly decent decline early in the period and then a leveling off more recently. So now if we switch our attention to alcohol, we are looking at past month alcohol use among adults, and you'll notice the top line is alcohol use generally. The bottom dashed lines are binge drinking. And so alcohol use has been fairly steady over time. Florida bumped up above the national prevalence rate for several years, but then has seen a decrease in recent years. And then binge drinking has also been fairly steady over time, although you'll notice that, again, with NSDA, there was that large revamping of the survey in 2015. You will see a little bit of a bump in the rates here in terms of compared to the previous period. We do see a little bit of a decline in Florida over in the most recent years. So if we look at past month alcohol use among adults, you'll see for most of the regions, there's not a lot of variation with the exception of South Florida, which has consistently lower rates compared to the rest of the state. If we look at alcohol use among youth, again, similar trend over time that we've seen with other substances, that use has declined. You'll notice, however, in the last couple of years of data that we have seen a little bit of a bump in alcohol use. Binge drinking, we don't seem to see the same little bit of an increase there. It was fairly steady early in the period from about the 2002-2003 data, and then started a decline in 2006-2007 over time, and that's been fairly stable. But we have seen a little bit of an increase in the last few years for which we have data after a fairly steady decline over the period. I do not have comparisons between substance use and infectious disease in this presentation. Okay, and then if we look at past month alcohol use by managing entity region, you'll see that these rates by region are quite tightly compacted around the Florida rate, that we don't see a lot of variability or variation between regions. Early in the period, you'll notice that we saw South Florida was kind of lower than the rest of the regions, but all the regions are fairly tightly packed until through the period. This was past month, so now we'll look at both lifetime and past month. So this is alcohol use among youth for lifetime is the top line and month is the bottom line. And again, you see that fairly consistent decline over time, although we do see a leveling off with lifetime use of alcohol in the last couple of years as well. So these data, though the prevalence rates are different because they ask about different time frames, the trends and patterns that we're seeing are very consistent across the different data sets and the different ways in which the questions are asked. So the Florida rate is below that of the nation, and it has, in terms of the whole period of investigation, there's been a steady decline until recent years, maybe an uptick here in the last couple of years. And same thing with current use, although we haven't seen that same little bit of an increase that we see up there with the lifetime use. So if we look at alcohol use by youth by managing entity region, you can see there's maybe a little bit more variation between the regions here, but not a lot. The trend is basically the same across all the regions in Florida. And here's the past month by region as well. And again, over time, not a lot of variation between the various regions, and the patterns and the trends are the same. So now we'll talk about several substances among youth only. So this is inhalant use among youth, lifetime and past months. And you'll notice that for years we were seeing a downward trend until about 2016, and then we've seen a recent increase in inhalant use in the state of Florida and the nation as a whole. Now, the rates in Florida are staying below those of the nation, but still concerning that we see a bit of an increase in the last 2 years or so of lifetime use. And then if we look at past month use, we don't see quite the same increase over time that we did in the past month use, generally declining over time and more of a leveling off, although we might be seeing the start of a little bit of an increase in the last year or two. I don't have those data divided out by middle school and high school in this particular webinar, but that's a question we could look into. We just report all the data for the youth together in this. If you look at the Florida Youth Substance Abuse Survey report, you would probably be able to find that in there. I believe all of those data are reported out by age group. And if we look at lifetime inhalant use among youth by managing entity region, again, you saw more variation in the regions early in the period, but more recently, the rates have fairly well converged around the state average and are pretty consistent in terms of the trend for sure. You will notice that here Broward and South Florida, no, that is Southeast Florida, have come down a little bit from the others in the last couple of years. If we look at past month inhalant use, again, here we have generally a downward trend until the last couple of years, and from about 2011 to 2016, it's pretty tight, little variation between the managing entity regions, although you will notice that in this last 2 years, Broward has bumped up quite a bit over all the other regions. And if you look there, you can see Broward is the purple line, or lavender. If we turn our attention to hallucinogens among youth, so again, we have lifetime and past month use for the nation and for Florida. And again, same, you don't see as much of a downward trend over time with this substance, but you do see, again, a cause for concern in the last year or so with an increase both nationally and in the state of increased use, lifetime use, and past month use in the nation. Now, Florida is remaining pretty flat for current use, but maybe this is an indication of earlier initiation of hallucinogens in the last period. And if we look at this by managing entity region, you'll notice that there is a bit more variation between the regions. And so I have those on separate graphs for you. So if you look, again, the gray line is Florida, the blue line is the specific region. And here we have the Suncoast and South Central parts of Florida, with the rates being a little bit higher in that region than in the state overall, and seeing a bit of an increase in the last couple of years. This is Northwest and North Central Florida. Again, in the last several years, the rates in the LSF region being higher than in the state as a whole. Here you have the Panhandle, where use was quite a bit above the state. I mean, relatively speaking, because again, remember the prevalence here we're talking about is 3 or 4% here, was above the state, but then has seen a larger decline than for the state, and so now converging again with the state rate. And here we have South Florida, which has been pretty consistent over time, but you've seen a little bit of an increase in the last couple of years. And then Southeast Florida, higher than the state rate, but a pretty marked decline in the last couple of years to bring it down below the state rate. So you can see with these regions that there's a lot more variability. Some of them are increasing, some of them are decreasing across the state with regard to this substance. Here we have a pretty consistent decline over time to put them to put Central Florida CARES health systems. This is that East Central, those couple of counties on the East Coast. and then Broward is below the state average and continuing to decrease. So if we look at past month, you see a little less variation among the managing entity regions, with South Florida, Southeast Florida kind of going below and a few increasing. So if we look at club drugs among youth, for Florida as a whole and the managing entity regions, you see this is one of the areas where we see more variation between regions than we have, I think, for any of the other previous symptoms. And you'll notice that overall there is a decline in Florida, and it's pretty consistent by region that the rates are declining. It's just a matter of how much. And you can see that there's quite a bit of variation between regions. So here is for the panhandle over time. So again, seeing that general decline over time, but flip-flopping between the region and the state of Florida, about 2/3 through the, little over halfway through the period there, but seeing a consistent trend over time. So northwest and north central Florida consistent with the state as well. Here you have, so this is Suncoast and South Central Florida. And then those three central but the East Coast state counties in Florida. So here again, the trend is very similar in all of these regions for the state as a whole and each of the regions, but there's more variation across the time frame. Excuse me. All right. Oh, Karina, I seem to not be able to advance my slides for some reason. So I think this, there we go. I think this is a good place for us to take a break, Karina. Is that right? Are there other questions we want to take a moment for me to entertain before we go on 5-minute break? And I do apologize to everyone. If you put a question in the chat or the Q&A and I didn't see it, please feel free to ask it, type it in again. I think, Karina, you were also trying to keep up with those.
Yeah, I'm not sure. Were you able to answer how large were the samples for the managing entities?
In terms of the sample size for the surveys for each MER, I don't know the answer to that question. It's something I can probably figure out. So I do know for like NSDA, they have about 70,000 individuals age 12 plus across the country that are going to be given the survey this year. Of course, that's divided up. They have, all of these surveys have complex sampling strategies that they use. Yeah. What they do is for certain years, they take, so for the Florida Youth Substance Abuse Survey, of course, we could, let me take a deep breath and back up and try to answer this more cogently. For all of these, we have to get sub-state estimates at the county level and then compile them into the managing entity region. So I'm guessing if it's, that it would be similar to the population distribution. And most of these, for the Florida specific survey, for example, those are annual data and you can read their report to get more information about their methodology. For the NSDA data, those are 3-year averages. So that's one of the ways in which we deal with the somewhat small sample sizes when you're getting down to the county level to be able to do those sub-state estimates. I hope that answered the question.
Okay, thank you.
You're welcome.
We also had a couple questions. Do we know what they are using, and can you give an example of club drugs?
Yes. So I'm sorry I didn't point this out. If you look at the bottom right-hand corner of the slide, So the drugs that are included in the club drug classification is ecstasy, Rohypnol, GHB, or ketamine. So that's how they define club drugs. Club, easy for me to say, right? Club drugs for that question. And I don't know that Karina or I mentioned this at the start of the webinar, but on the last slide, you will get, you'll see my email address. And so anyone who has follow-up questions is also welcome to email me specific questions. And then there will be an annual report coming out that is the companion to this slide or this webinar. And so that will have much greater level of detail about some of these questions that may be helpful as well.
And then we had one question, is there a distinction between powder and crystallized?
No, there is not a distinction.
I think that's all I see right now. So if you're ready to take your the break, we can go ahead and do that.
We can do that.
Okay, so if everyone can be back in about 5 minutes, so say 11:06, that would be great. Thank you. Sorry, Kelly, I lost track of time. So we can get started if you're ready.
Sure. I'm trying to answer a question in the Q&A, and I'm not able to respond for some reason. A question about Rohypnol. It's a benzodiazepine not approved for use in the U.S., and I have a link to the NIDA page on that. It's the drug that you may have commonly heard of, referred to as the date rape drug.
Okay. If you want to email it to me, I'll get it.
Maybe I can put it in the chat. Let me see if that'll.
The chat's a little more user-friendly.
Okay, I'm going to put it there. So if you were one of the two people, yes, that worked out well. It's interesting. So someone also asked a question at the break about meth, amphetamine, and anecdotally, a lot of people are hearing that increased use is on the rise. If you look at the FADA website, I actually just wrote a trend alert about this. These data are a little bit misleading because of the change in the NISDA question. We only reported those data for the 3 most recent years. If you go back and look at that trend alert, you'll see that if you look at those data over time, there has been an increase. It's slowed down in the last couple of years. And the other comment that I would make is that these data, you'll notice, are sometimes they lag, right? So we conduct a survey, someone has to compile all the data, clean it up, and get it ready for sharing it publicly. And so there's always a lag for some of these data, and you'll see as we get to the end of the presentation some of the impacts of meth in terms of fatal overdoses. So I think that that's a really good point, and that these data are a little bit misleading for adults, at least, in particular.
And then we had a question, and I'm not sure if you got to this one yet. Is inhalant use mostly about middle school age?
So that one, I do not know the answer to that question off the top of my head. I know in the Florida Youth Survey, their report it is very extensive in terms of being able to look at some of those specifics. And I believe that report is available on the FADA website. You can certainly Google it. It's very easy to find.
And if whenever you're answering the questions, if you could just repeat the answers, because everyone in the audience does not see the other questions.
Oh, I'm sorry. I didn't appreciate that. So yes, I can state the question that I'm responding to.
Okay. Thank you.
All right, so I'm going to go ahead and move on to the next section. So then we do a little bit of, we compiled a bit of data on other consequences. So again, if we're moving now up the pyramid that you'll recall from the beginning of the talk. So now we're going to look at data specific to Florida. So from the UCR, the Uniform Crime Reports, and then some data from the Highway of Safety and Motor Vehicles. And again, the specific data will be on each of these the slides at the bottom of the slide. So arrests and citations. So drug arrests are a fairly small fraction of overall arrests. Despite recent declines in arrests overall, drug arrests have remained stable over time. There is some variability by managing entity region, especially over the last 5 years. In terms of citations for DUI, they have been on a slow but steady decline over time, and there's similar variability. The variability that we see in arrests among MERs is similar to those that we see for DUI citations. So if you look at total arrests in Florida and by managing entity region, you can see the black dashed line is Florida, so pretty flat, maybe a little increase early in the period, and then from about 2008, a fairly steady decline. And that's been the general trend for all of the managing entity regions. You'll see the Panhandle has seen less of a decline compared to the rest of the state overall. And then if you look at drug arrests, so remember, this is total arrests. this is arrest specific to drugs. And you'll see, notice that in these two graphs, I kept the y-axis the same so you could see kind of what proportion the drug arrests are of arrests overall. And they're a fairly small fraction. And you'll notice that there's far less variability by managing entity region when we look specifically at drug arrests. You'll notice, though, that we do see that increase over here in the Panhandle. And then you can see that the South Florida seems to be declining a little bit faster in the more central parts of the state. Now, notice what I did with my y-axis here. So here was 8,000. I moved it to 14,000 so you could see a little bit more clearly some of the differences between the managing entity regions. And again, here you'll note where the in the Panhandle, the rates went up kind of steeply and are starting to level back off a little bit. In the southern part of the state in Broward and South Florida, they're a little bit lower. And then the middle part of the state is pretty consistent with one another, at least in recent years. So here we have by the region specifically. So if you look at Central, this is the Sun Coast and South Central, and you'll notice that the order in which I'm presenting these managing entity region specific data are different with each thing that I'm presenting because I'm going somewhat in order of if there's regions that are above or regions that are below, kind of going in that direction. So that's the reasoning behind the presentation there. So here's Sun Coast and South Central. Fairly similar, same thing here in the central LSF. Again, this is all the, really the middle of the peninsula, well, all the way up to the northern part actually with LSF. And here's Southeast Florida. And then again, the outliers in terms of the managing entity regions were really the Panhandle and then Broward and South Florida, which is Monroe and Dade. So if we look at DUI citations, pardon me, again, a fair amount of variability between the managing entity regions. Here we have citations for central, so this is the East Central, those counties on the East Coast and the central part of the peninsula. Here is LSF, which is Northwest and North Central Florida, very similar to the rates across the state as a whole. Not much difference between Southeast and Florida. And then you'll see here, this is the Sun Coast and South Central regions. There's more variability here. Trend is the same over time, but the rates are a bit higher in this region compared to the state as a whole. And same thing true with the Panhandle, with a little bit of an increase in the most recent year. And then we have the rates that are below the state. This was in Broward, which was tracking fairly low below the states, and then they've kind of jumped up in the last couple of years and are consistent with the state rate. And here we have DUI citations for South Florida. And just to make a note here, this is rate per 100,000 here. So the number of citations per 100,000 population. And these rates are based on the population of each of these regions. So then if we turn to motor vehicle crashes, injuries, and fatalities, those involving alcohol, after a sharp decline in 2013, motor vehicle crashes involving alcohol have continued to decline slowly. And there, for this, again, is a lot of variability in the managing entity region specific rates of MVC. And these generally decline as you move south through the state. Rates in the Panhandle are above the Florida rate, and rates in South Florida and Broward are below the state rate. Injuries resulting from alcohol-involved motor vehicle crashes have experienced a similar decline over the entire period, with a smaller degree of variability between, or variation between the regions. Same patterns, though, that you see. And then the rates of crash that involve a fatality is an even smaller proportion of the overall rate, and they have also been declining over time. We'll show you some of those data. So here's alcohol-confirmed crashes, and we only have this by managing entity region, obviously, for the most recent years of data. And as you can see, just like with some of those previous arrests and citations, there's a fair amount of variability between the regions. but a consistent pattern in terms of the variability, with the Panhandle having some of the higher rates, Central Florida, and I mean Central Florida very broadly here, most of the peninsula having kind of rates that track with the state, and then those 3 southern counties having the lower rates. So again, I kept the y-axis the same here so that you can see the proportion. Alcohol, these are crashes that resulted in injury, so these are subsets of the ones that you just saw. A little less variability by managing entity region, and you'll notice that crashes involving injury have declined in the Panhandle to be more consistent with some of these other rates in the middle part of the state. Still, South Florida, those 3 southern counties with lower rates compared to the rest of the state. And then when we get to fatalities, you can see there appears to be a good bit less variation between the managing entity regions. And then again, I've changed the y-axis here. Here's where it's the same axis as the injuries, the crashes involving injuries, and these are the crashes involving fatalities. But then so you can see the variability between the regions, I've changed the y-axis to 10. So here you do see a different pattern in terms of which region has the most crashes involving a fatality. You'll notice that you no longer see the Panhandle BBCBC region up at the top, but instead that's the northwest, north central Florida, so Lutheran Services Florida, that region has the highest rate here. South Florida is still consistent, and the others are in the middle of the pack, fairly close to the Florida rates. One concern here is this increase that we see right here for those counties, the east central counties. Everyone else is tracking down and they have gone up. So a good bit of variability or variation between the managing entity regions. If we look at alcohol confirmed crashes and fatalities, again, this is the same data that we were looking at before, but by managing entity region, you can see the same. So the crashes are the top line and the crashes involving fatalities are the bottom line. So even though we see more crashes in the Panhandle, we are not seeing a lot of difference in fatal crashes in that region. And then so you can see similar trend over time for these. Higher levels of crashes for some of these regions, but not necessarily the fatalities, except again for LSF, we do see a higher rate here. And then consistent with the state for fatal crashes, but below the rate for the state in those 3 eastern central counties. And then we have alcohol confirmed crashes and fatalities for Southeast being pretty consistent. And then you'll notice here in Broward County, pretty far below the state rates for both Broward, Monroe, and Dade. Okay, so those were alcohol-involved crashes. These are the same series of data, but for crashes that involve drugs. So though drug-involved motor vehicle crashes are less frequent than alcohol-involved motor vehicle crashes, they are on the rise. We'll show that in subsequent graphs. Differences in the MER-specific rates are similar to what was observed for the alcohol-involved crashes, with the highest rates observed in the northern part of the state and the lowest in the southern part of the state. Or southernmost part of the state. Based on the data available, drug-involved motor vehicle crashes that result in injury are the majority of drug-involved motor vehicle crashes. And I suspect this is all related to surveillance issues in terms of, when these data are sought to see whether drugs were involved in the motor vehicle crash or not. And based on the data available, drug-involved motor vehicle crashes that result in fatality are the majority of drug-involved motor vehicle crashes. So here we have the drug-confirmed crashes overall for the state, and you'll notice, again, I was showing you a y-axis for the alcohol involved of 60 per 100,000. This is a y-axis of only 10 per 100,000. So these are far less often occurring, it appears. Same level of variability you'll notice though between those various MERs, with again highest rates in the higher, in the more northern counties of the state, lowest rates in those three southernmost counties, and then the sort of middle section of the state more consistent with the state rates overall. Here are the ones that have confirmed injuries, and so you'll notice that the crashes involving injury and fatality comprise a much greater proportion of the crashes that where drugs are known to be involved. And again, you see a fair amount of variability between the various managing entity regions. And then the rate of fatality stands out again here for the LSF region, with Panhandle rate of fatalities dropping down closer to the rate for the state overall, and those three southernmost counties being below the state rate. And here we have those data by MER specifically. So again, high rate, the incidence of motor vehicle crashes involving drugs in the Panhandle, but not as much difference in the fatalities. And then we show these over time, and you can see these are much higher. Just go through these. I didn't mean to hit the advanced key so quickly. So here, Central Florida, much more closer, and this is the Suncoast in that South Central Florida region, much closer. And then we start to see some lower rates as we move down in the state, further south in the state.
Dr. Gurka?
Yes?
I'm probably going to butcher this, but someone is asking, what is Rohypnol or Rohypnol?
Oh, Rohypnol. So that is one of the club drugs that it's a benzodiazepine that's not approved for use in the United States. And if you look in the the chat, I gave, there's a link there to a table on NIDA's website, the National Institute for Drug Abuse. It's the club drug that you often will hear referred to colloquially as the date rape drug or roofies. So that's what that is. So then if we look at crashes in which both drugs and alcohol were involved, again, similar patterns to what we saw with the other crashes, injuries, and fatalities. These crashes occur even less frequently than the previous two and have been fairly stable over time. The differences, again, that we saw by managing entity region are pretty consistent. And based on the data available, alcohol and drug involved motor vehicle crashes that result in injury are again the majority of the alcohol and drug involved motor vehicle crashes. And so I'll just show you those graphs here. So again, a little bit of variation between the various managing entity regions, but a fairly consistent story. Here, North Central, Northwest Florida is showing a higher rate of crash as well, where the Panhandle is more consistent with the vast majority of the central, the peninsula of the state, and then those southern, the three southernmost, well, three of the southern counties have the lower rates. See a little less variability when you look at the crashes with injury, and then a little less variability with fatalities, of course, with this region of North Central and Northwest Florida standing out above the others. And again, you have a couple of regions here where you're seeing an increase in recent years, which is cause for concern. Whereas the others, you have some, about half of the regions, the rate's gone up, and about half they've gone down. But again, these are fairly small rates and not a lot of change, but still cause for concern if you're seeing an increase, like, for example, what we're seeing here with the Panhandle, the blue line. So if we look at these by region, again, you'll notice that the crashes and fatalities in the LSF region are well above that for the state as a whole. If you look at the Panhandle, Big Bend community-based care, theirs are more consistent, their rates are more consistent with the state as a whole, as well as Central Florida Behavioral Health Network, Central Florida Cares Health System, and then as we get further south into the state, Southeast Florida has a little bit lower rate, and the Broward Behavioral Health Coalition is pretty low, and so is the South Florida Behavioral Health Network. So now we're going to move on to talking about two different types of morbidity. So I'll present to you both emergency department visits and hospitalizations due to drug poisoning. So for morbidity, we have for the U.S., we use Whiskers, which is the web-based injury statistics query and reporting system. And that is a great dashboard that anyone can use for national data. And you can get, Whiskers isn't as good as Wonder, which I'll present in just a few minutes. That uses data from the National Vital Statistics System to look at sources of injury. And then for the Florida data, we use data from the Florida Agency for Healthcare Administration. We did not get these data directly from ACA, but rather pulled these off of publicly facing dashboards, specifically Florida Health Charts, which is maintained by the Bureaus of Community Health Assessment and Vital Statistics. Some of these data, what we can present here is fairly limited. So poisoning hospitalizations comprised primarily of drug poisonings declined in the two most recent years of data in Florida, a trend also seen at the national level. Poisoning hospitalization rates in Florida have been more stable over time than those for the nation as a whole. And the gap between the national rate and the rate in Florida was about the same in 2018, following a narrowing in the previous year. And I'll show you all of these data in just a minute, with Florida experiencing fewer hospitalizations per 100,000 population than the nation. In terms of variation between the managing entity regions, it does exist. Poisoning hospitalization rates for LSF, which is the North Central and Northwestern region of the state, and Central Florida Behavioral Health Network regions exceed the state rate, and then the rate is the lowest in the South Florida Behavioral Health Network. And the same pattern was observed for drug poisoning. So I'll show you these data. You'll notice on this graph that these dashboards only recently started breaking out the drug poisoning. I put poisoning on these graphs overall because you'll notice if you look specifically at Florida here, we have drug poisonings for the last 3 years of data, and drug poisonings comprise the majority of poisonings and drive the trends that you observe. So even though we don't have the drug poisoning data for the whole time period, the poisoning trends overall give us a really good clue about what's happening with drug poisonings. And you'll notice again that Florida did have a hospitalization rate above the nation, but in the 2010, between 2010 and 2011, that switched. And the rate's higher for the U.S. overall. You'll notice that the trend is about the same in terms of, Florida had a little bit of a decline in the middle period of the time period, and then it goes up in recent years and is starting to come down a little bit. And what is interesting about this recent trend is that's also consistent with fatal overdoses that we'll see in the mortality data in just a few minutes. If we look at the hospitalizations due to poisoning by managing entity region, you can see there's a good bit of variability with South Florida kind of at the bottom here. And as I mentioned a few minutes ago, LSF up at the top here. If we look at specifically drug poisoning, you'll notice that the variation looks about the same. Again, these are those data that we only had for the past 3 years, but they give us an indication that, the trends that you see here are pretty consistent, and the majority of these poisonings are comprised of drug poisoning anyway. So if we look at this going through each of the managing entity regions, again, in the LSF region, we have rates that are above that for the state. You'll notice, though, the pattern is very consistent in terms of when you see trends increases over time, decreases and increases, and North Central and Northwest Florida has seen a decline in the last couple of years, like the rest of the state. I'm going to take just a break to take a drink of water. I noticed that my voice was going a little bit. I hope everyone can still hear me. So again, here is for the rates that you see in the Central Florida Behavioral Health Network. So this is the Suncoast and the southern part of that central region of Florida. And again, higher than the state overall, but same trend over time in terms of a little bit of an increase early in the period, a decline, a little bit, a couple of years of increase, and then recent decline in the last couple of years. Not a lot of change if you look at the period as a whole from 2007 to 2018.
I had a question that was asked a couple minutes ago. Is there a breakdown or breakout for youth on alcohol and drug crashes?
I'm not understanding the question, Karina.
Yeah, I apologize. Is there a breakout for youth on alcohol and drug crashes? Maybe you have a bar graph or something on that, or breakdown of that information.
Oh, I'm sorry. I apologize. I missed the word youth in that question. I don't think I have those broken out by youth. We did not do that. I'd have to go back and look at the data source. I don't know off the top of my head if it's easy to discern if it's the driver. I mean, you have to define as driver, occupant, or pedestrian, potentially in terms of youth, and would it be anyone who's involved in the crash? And I don't remember what the crash data looked like specifically off the top of my head to know, but that's something that I'm happy to follow up with. If the person asking the question wants to send me an email afterwards, we can look at the data source and get back more information on that. And I'm sorry, I didn't realize that I didn't have my question and answer. I wasn't at the bottom of it, so I didn't see that question come in. Okay, so if you look at hospitalizations due to poisoning up in the Panhandle, so Big Bend community-based care region, a bit below the state average, more so early in the period, and converged a bit more in the middle, but a fairly similar pattern, except in the most recent years, there has been a bit of an increase in this region when other regions of the state have seen a decline. So again, lower than the state rate until this previous year, or the last year for which we have data, 2018, and those rates have bumped up above the state rate overall. Here we have the Central Florida Cares health system, and so this, again, these rates, the pattern looks fairly similar to the state as a whole. A little bit of an increase in 2017 compared to the state where it was declining, but then this region also saw a decline in the latest year. Then this is the Southeast Florida Behavioral Health Network region, and even less variability or variation between these rates and those of the state. They track very closely. A little bit, a tiny bit of an increase in the drug poisoning hospitalization, it looks like, in the for the latest year.
And there were a couple of statements and questions. E-cigarettes are included in poisoning, and there has been a big spike in poisoning since e-cigarette use started, which is about nicotine poisoning. If overall drug abuse rates seem to be going down, why do you think the hospitalizations aren't following the trend.
So in terms of the hospitalizations not increasing or not going down, I can't see the question, Karina, so I can't.
Again, it says if overall drug abuse rates are going down, why aren't the hospitalizations following that same trend?
Oh, in terms of the comparison between youth and then the hospitalizations. So I have some more comments about that at the very end of the presentation. I suspect, and remember, when we looked at adult use, it was fairly steady over time. Youth, lifetime use was on the, well, youth in general appeared to be declining. Now, these are rates for the state population as a whole, and recall that youth only comprise 8% of the state's population, where the 18 plus population comprised, it was 80 and a little bit of change, right, in terms of the population. So because youth make up a much smaller proportion overall, I think that probably has a lot to do with what we're seeing in these rates, and that these are driven more by trends among adults. I also think that polysubstance use is really important in terms of thinking about overdoses, and particularly fatal overdoses, in terms of which drugs people are using in combination and what proportion of the population that is using substances is using particularly dangerous combinations of drugs. But I'll hold off more comments on that until the end when we get through the mortality data, if that's okay. And again, these data for the hospitalizations are overall, and so they're going to be, driven a lot by some of the more common substances, and then also the ones that would, if you think about opioids and how much they've driven a lot of these trends, and as we see perhaps a little bit of a decline in that group, particularly with prescription only, then that's going to drive some of these trends. But again, we can talk a little bit more about polysubstance and the comments that someone made about methamphetamine in a little bit. Okay, there we go. And then, so here we have South Florida Behavioral Health Network. And you'll notice these rates are the trend exactly. The trend looks very similar within this region as it does for the state, consistently much lower than the state rates. And so here we have emergency department visits, and I'm sorry that I didn't swap the order of these, because these would be the overdoses that maybe bring you into the emergency department, but they can be treated there, and then you can be discharged without being admitted. I deviated from my going up the severity of the pyramid here. There's been a decline in emergency department visits due to poisoning and drug poisoning from 2017 to 2018, both in Florida and the U.S. That decline follows a 4-year rise in Florida, but Florida rates have been much more stable than the rates nationally that saw a steady and a larger increase in the 5 years prior to the decline. And we'll look at those graphs in just a second. And there seems to be less variability or variation between the different regions in ED visits. The Southeast Florida Behavioral Health Network rates increased over those for the rest of the state in 16 and 17, but declined again in 18. And then both the Big Bend Community-Based Care Network region and the Central Florida CARES Health System region experienced an uptick. So let's look at those data. So here's emergency department visits due to poisoning overall. One of the things that I will note is that there have been improvements in poisoning surveillance over this time period driven by the opioid epidemic. And so it's difficult to discern what of these increases that we see may be due to some of those enhanced surveillance efforts, particularly with syndromic surveillance, compared to an actual increase in use. So that's another thing to keep in mind when we're looking at all these data holistically in terms of thinking, why are we seeing increases here and maybe not there, to think about that as well when we're interpreting all of these data. And so again, you see a much larger increase in the nation overall from 2007 to 2018 than we did in Florida, but the trend is consistent in terms of a recent increase and then a little bit of a decline in the last year. And if we look at that by managing entity region, you'll notice that some of the regions that are higher or lower on this graph are a little bit different than we've seen in some of the previous measures that we've looked at. There's a fair amount of variability here, but the trend is fairly consistent. Certainly Southeast Florida had a much bigger increase than some of the other regions, but also followed by a much larger decrease. And then again, this is just same issue with drug poisoning versus poisoning and having only these data for the most recent years, but again, fairly consistent in terms of what proportion of the poisonings the drug poisonings comprise. And so if we look region specific, Southeast Florida again saw this much more marked increase from 15 to 17, but then a similar, you'll notice that the gap widened here, but then it's pretty much closed again. And that the drug poisonings comprise about the same proportion of the overall poisonings in this region as they do for the state overall. If we look at North Central and Northwest Florida, the trend here in emergency department visits is very similar for this region as it is for the state overall, a little bit above the state rate, but the trend over time is fairly similar. So fairly consistent early in the period with a little bit of an increase in 15 to 17 and then a decline in the last year. And then if we look at the Broward Behavioral Health Coalition, very similar rates in this region to the state overall. Same pattern in terms of the trend over time that we've seen in the other regions, even less variation between the Central Florida Behavioral Health Network and Florida overall. And similar here, you will notice though that this is the one region where we have seen no decline in this last year in emergency department visits for this specific region. So the trend was very similar over the time period until about 15, and then their rates went actually below the state rate a bit and then went up. So it's a more sustained increase for the past 3 years, albeit very small. And then this is for the Panhandle, a little bit of change in terms of the trend. Rates were above the state for many years and then dipped down below. Interesting, this region saw a decline from 2016 to 2017 and a bit of an increase from 17 to 18. So a little bit different pattern most recently for this region compared to the others. And then if you look at the South Florida Behavioral or Southern Florida Behavioral Health Network, similar trend to the rest of the state, just rates below the state rate. And so that's what I have for morbidity, and now I'm going to conclude with mortality. And again, this is the top of that pyramid. So these are the most severe outcomes related to substance use, although we could talk about alcohol and drug involved. Again, those crash fatalities are kind of in the middle, right? We're going to talk about mortality and then some final thoughts about the data overall. So for the U.S., we used data that we were able to get from Wonder, which is a really great data, a dashboard that you can get vital statistics data from. And you can get you can even get county-specific data for deaths. So if you're interested in your county-specific data, you could get that from this website as well, and then be able to do the U.S. rates as well and compare those, which will have them in these graphs. And then for Florida, we did use the Drugs Identifying Deceased Persons report from the Florida Medical Examiner. And then we also calculated our own rates based on those data. And then for some of the graphs, you'll see that we just, for Florida overall, we used Wonder data as well for consistency. So with regard to mortality, following a 4-year increase in the rate of drug poisoning deaths in the state of Florida, the state as well as the nation saw a decline in drug poisoning mortality in 2018. That being said, the mortality rate for 2018 still remains over 3 times the rate for 1999. And we'll look at those data in just a moment. And early in the current epidemic of fatal drug poisonings, the mortality in Florida exceeded that of the U.S. Overall. After a decline in the early 2010s, during which the mortality rate in Florida fell below that of the nation, the rate in Florida began trending up again. And you'll recall that that was around the time of the pill mill laws. And then for the first time in nearly 2 decades, the rate of fatal drug poisonings in the nation declined, and that same decline occurred in Florida. So let's look at these rates overall. So this is the age-adjusted mortality rate for drug poisoning in the U.S. and Florida. And if you look at the national rate, it has been steadily increasing over time for the entire period. And this is the first year, well, 2018, the most recent year for which we have data, was the first year where we finally saw a decline in drug poisoning, fatal drug poisonings nationally. Florida saw a similar trend early in the period, so for about the first 2/3 of this period. And then again, around the time where the pill mill laws were passed, we see a dip. There have been a number of different changes that have occurred as well. Increased use of PDMPs, PDMP, E-forces, those kinds of things that have driven some of these changes. And then a marked increase from about 2013 to 2016 that started leveling off, and then a decline in this last year as well. And this has often been described, again, it's hard to describe mortality data and not talk about opioids specifically, that this is consistent with the 3 waves of the opioid epidemic. It's been described, as prescription opioids primarily, and then a shift to heroin, and then a shift to fentanyl. And so we'll talk about opioids again because it's hard to get away from it. So they remain the most common cause of death among fatal drug poisonings across the state and the nation still, even though we are finally starting to see some recent declines. And the patterns and trends in overall drug poisoning rates are driven by opioids. So here are the data specifically for any opioid in the U.S. and Florida. And again, you can see that there's been, if you look at this graph compared to the previous one that I just showed, the trend looks exactly the same because it's largely driven by the opioids. However, specific opioids driving the trend has changed over time. So this is what I just alluded to a moment ago, that the epidemic has really been described as having 3 waves, where early in the epidemic, the deaths were largely attributed to prescription opioids only, and maybe in combination with other drugs such as benzodiazepines, but still mostly prescription opioids were involved. That switched to a surge in heroin, deaths that involved specifically heroin, and then most recently, deaths have been, the increases that we've seen are with synthetic opioids. And there are a couple of trend alerts, again, on the FADA website if you're interested in looking at some of these topics specifically over the last year. And when we say synthetic opioids, we're primarily talking about illicitly produced fentanyl. And here we have age-adjusted mortality rates for natural or semi-synthetic opioids over time. And so you can see this increase early in the period, and then actually a dip in Florida, and then kind of a little bit of a leveling off here at the end in 2016, 17, 18, or excuse me, increase, dip, and then a little bit of an increase with a leveling off. And then if we go to heroin, you can see that this increase happened a little bit later in the period, and again has leveled off in recent years, even seeing a decline recently. And then if you look at the synthetic opioids, and this excludes methadone, you'll see that the increase is really late in the period. So these 3 graphs kind of demonstrate those 3 waves of this epidemic. And in Florida, you'll notice nationally there was a bit of a decline from 17 to 18, whereas Florida still experienced an increase in these data. These, I do not have these data broken out by age. If you look at deaths, they're much less common among youth than compared to like the middle age range, 35 to 44, 45 to 54, those age ranges. But those rates are pretty easy to get in Wonder. You can get them broken out by age group if you're interested in looking at those data by age. My understanding, but Karina, correct me if I'm wrong, is that yes, the presentation will be made available. That's correct on the FADA website?
Yes, it will be available. We have it posted along with the recording within 30 days. It's usually sooner.
And in the annual report that is forthcoming, there are links to all of this. And then also there are links in these slides. I just don't know if you'll have access to that specifically. But again, anyone is welcome to email me, and I'm happy to send those, that information out to anyone who requests it. And I am going to post a link to the Wonder website.
And we had a couple of questions. Let's see. Do you have a readily available link for Wonder?
I just put it in the chat.
And besides opioids, what are the other drugs gaining ground in the OD or ED visits?
So we don't have the hospitalizations and the ED visits broken out by specific drug because those data were not available to us. But I'm about to go through the mortality based on various drugs. So I've ordered these in the proportion of the drug poisonings that each of these drugs comprise, so kind of in descending order. So we'll get to those next. So I'm going to table that question for the moment until I get through these next few slides.
Okay.
Oh, let's see. So stimulants, fatal drug poisonings due to stimulants have been recently increasing across the nation as well, and Florida has experienced a nearly parallel rise with the U.S. experiencing rates similar to that of the nation as a whole. So I know there were questions earlier about methamphetamine particularly. Here is cocaine. If you'll notice the Florida and U.S. rates increase early, throughout the first decade of the 2000s, followed by a slight decrease. And you'll notice, though, that there has been an increase recently. Now, a decline in the most recent year, but you'll notice that the rates in Florida have also diverged a bit from the U.S. If we look at other psychostimulants, so this is the category that will include methamphetamine but excludes cocaine. And you'll notice these were a very small proportion of the deaths early in this period, but you'll notice, starting around 2009 or so, these really start to increase. And though the rates are low, if you look at the relative rate, the relative increase in the most recent years compared to where these numbers started out in 1999-2000, this is a really large relative increase. So this is a big concern in terms of the role that stimulants are beginning to play in fatal drug overdoses. Fatal drug poisonings due to alcohol comprise a minority of poisoning deaths, and the incidence of these deaths has remained largely unchanged over time, keeping in mind that there are lots of other types of deaths that are alcohol involved, whether those be motor vehicle crashes, violence, those kinds of things. So these are strictly deaths that are related to alcohol poisoning. And then fatal drug poisoning due to cannabis are even rarer. Florida saw an increase in the last year. Excuse me. So you'll see that, alcohol poisoning has been fairly stable for the last decade. I've just changed the y-axis there for you. And then here's cannabis with a bit of an increase here in the end. And again, we changed the y-axis so you can see those a little bit better. And the last thing that I'm going to talk about a little bit is kratom before I talk a bit about polysubstance. Kratom was just, or metrogynine is the scientific name for it, was just recently added. It will only be required in all medical examiner regions in 2020. And I want to draw your attention that for 2019, this is only for the first half of the year. So if you double these, it looks like maybe it's starting to see a little bit of a decline, but this is one of those drugs that the Florida medical examiners are really paying close attention to Some of the other drugs, we did not see any particularly salient trends to include in this webinar. So there they are, the rate instead of just the number. It's fairly rare though, 0.4 per 100,000. That was about the highest rate there. So the last thing that I wanted to talk about before we wrap up is the top 10 co-occurring substances. So this is for chronom death specifically, and you'll notice that fentanyl is the most common there, and fentanyl analogs is third. So if you combine both of those, it's involved in a lot of those deaths. So polysubstance involvement. So if you'll look at this table, here I have from 2003 to 2018, this is deaths in which any drug was involved. This is the proportion of, or the number of deaths in which multiple drugs were involved, and this is the percentage. So you'll notice back in 2003, less than half of the fatal drug overdoses were polysubstance, and this has been steadily increasing over time. A little bit of a dip here, but over 60% of deaths in the most recent year involved multiple substances. And if you look at what those substances are, we have the top 10 occurring substances among fentanyl-caused deaths. So these are the deaths in which there were multiple drugs, but fentanyl, for example, for the top left-hand bar chart, was deemed to be the cause. And then fentanyl analogs is the next one. So if you look at some of these, you know, like morphine and heroin, that's an artifact of toxicology. And it's difficult to tell which drug it was. But you'll notice that among these, if you look below fentanyl analogs, of course, you're going to see fentanyl and analytes, but then cocaine is the next one. And then for the fentanyl-caused deaths, the leading co-occurring drug is cocaine. And then if you go down to over to the bottom right-hand graph, you have cocaine-caused deaths, and you'll notice that the most involved substances there are the fentanyl and the analytes. And so there seems to be an increase, or at least in many of these deaths where we're seeing both the cocaine and the stimulant deaths increasing, and recently increases in opioid-related deaths specific to fentanyl, but there's a lot of polysubstance. And so exactly. And someone in the chat mentioned the new speedball. And so I think because the fentanyl is such a dangerous drug, and now we're mixing that with cocaine and methamphetamine, even though we didn't see that many differences in the use data, sort of at the bottom of the pyramid, it's because of the drugs that are involved in some of these deaths that we're still continuing to see these increases. And that polysubstance is really a big problem. And then here we have methamphetamine. Again, amphetamine is just, this is based on toxicology, so it's not the neatest presentation of data. But if you look below that, the next substance that's most likely to co-occur with methamphetamine is fentanyl. So I think that's a really important note in terms of thinking about harm reduction and you know, work to reduce fatalities, that polysubstances continues to be a really important topic. And that though we're seeing some either steady prevalence or declines in prevalence, that this may be explaining why we're not seeing some of the declines we would like to see in some of the other areas in terms of morbidity and mortality. So in conclusion, substance use overall is stable among adult Floridians and declining among the youth of Florida. Rates of poisoning, hospitalization, and ED visits have been steadier over time in Florida than the nation, with decreases being observed in the latest years, which is largely consistent with the use trends. And then though drug and opioid-specific poisonings declined in 2018 for the first time since 2013 in Florida and at least 1999 nationally, an increase in deaths due to psychostimulants was observed. Polysubstance continues to be involved in an increasing number of drug poisoning deaths, particularly related to opioids and stimulants. And so with that, I know we're a couple of minutes over, and I apologize for that, but I can still take some questions. And again, this is my email address, kgurka@ufl.edu. I'm aware that you'll be getting some more, additional resources on the FATA website, but you're always welcome to just email me directly and ask specific questions about anything that was in the slide deck specifically. So let's see.
We had a question about tracking issues related to bath salts and flocka.
So we did not, in terms of emerging drugs and emerging threats, I did not include those kinds of data in this particular presentation.
And we had another question about someone who's a counselor, and they've noticed a recent trend during the COVID pandemic of increased alcoholism and substance use. Do you have any data on the upward tick?
That is an excellent question, and we have been trying to think about what data sources would be contemporary enough, because I think, I'm given the audience here in terms of the behavioral health workforce, even though COVID is really front of mind for most people right now, the impact that it's having on people in terms of economic fallout, the consequences of stay-at-home orders, social isolation. We also worry about increases in domestic violence, whether it be interpersonal or child abuse and neglect. So all of these issues, I think, are really heavily on the minds of those of us who work in this space. But I don't know the answer yet in terms of if we have any data. I've been looking into possibly using syndromic surveillance data to see if we could do that to get an idea about what's been happening, because it's such a recent event, over the last 3 months or so. Data systems, unfortunately, are not often real time. And so I think that's a really important note, though, and I don't have the answer to it, unfortunately, at this point.
What is your take on someone mixing kratom with prescription Adderall?
I don't have a take on that, to be quite honest. I see Valerie asked that question. I would have to do some research on that. I don't have an answer for that specifically. And unfortunately, a lot of the prevalence data that are collected about use asks about single substance use. You can do some, I would imagine that you could do some more sophisticated analyses if you've got those data and look at some of the polysubstance use, but that takes a much deeper dive in terms of often getting that source data and being able to do some of that work. I would be curious to hear more about that trend, if that's something that's being seen, among people who are treating patients.
And then we had one more question, data on deaths of despair.
Oh, despair.
Okay.
Yes, so I'm not sure if that's a question or a comment. So there's been a fair amount of work done in recent years on deaths of despair, and actually that's a topic. There's a reference in one of the trend alerts related to overdoses, in terms of looking at alcohol-related disease and substance abuse and suicide, and looking at those over time and noting that those have increased. And there's a group of economists who have done a lot of work related to this idea of deaths of despair as well. That these deaths are pretty high, particularly in the middle age groups.
Well, Kelly, we want to thank you for your time today. You gave a lot of information, and we really appreciate you taking your time out to share with us. And I know a lot of people are asking about the presentation. Yes, it will be posted along with the recording within 30 days, usually sooner. Again, Dr. Gurka, thank you so much for your time today. And if you guys can just hold on for a couple minutes with I have some housekeeping items I need to go over with you. So once you exit the webinar, you're going to be directed to complete the evaluation on our FADA website. Normally we send an email, a thank you email, if you have registered and have a profile with our website. Once you complete the evaluation, we will give you CE credits within 30 business days. You do have to include your healthcare practitioner number and prefix if you want it reported to CE Broker. Once you sign into the site, you will be prompted to complete the evaluation, and this is pretty much what you'll see to sign in. Again, you have to have a profile to complete the evaluation, and then the evaluation will pop up. If not, you can always copy the link in the thank you email and paste it in your browser to complete the evaluation. You will get a thank you, you've completed the evaluation after it's completed. And again, you'll get a second opportunity to complete the evaluation once within the next 30 minutes. So it will be in the thank you email. The evaluation does close on midnight, Friday, June the 19th. We usually keep it open for 2 days, but I've left it open a little bit longer for this evaluation. We do want to thank you for participating in today's webinar, and we'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation. Thank you.